Hello, my name is Sarah. I'm the Perineal Care midwife at the Royal Surrey County Hospital. Today I'm going to show you a video of how to do something called perineal massage. Evidence has shown that perineal massage can help reduce the risk for the need of an episiotomy or trauma, including a 3rd or a 4th degree tear. We recommend the use of vitamin E oil because it is evidence-based and has shown to reduce and soften scarring. It is also hypoallergenic and is safe to use on your vagina. So here is a model of a vagina. I recommend that everyone is familiar with their own vaginas. A very quick anatomy lesson. What you can actually see on the outside is actually called a vulva. The internal structure where your baby comes out is actually the vagina. And down here we have the anus. In between the vulva and the anus is an area of skin called the perineum. And behind the perineum is a structure of muscles known as the pelvic floor. These muscles are responsible for your ability to hold urine and control your bowels. It's also a part of the body that women are commonly fearful of tearing during delivery. We know about 85% of women will experience some degree of tearing during childbirth. The majority of those women will have an easy healing process with no ongoing problems. So with a clean thumb with vitamin E oil on it, place it inside the vagina. If you feel comfortable in doing so, apply a little bit of stretch down. We are now going to use a 9-3 motion with about the same pressure as if you were moulding with fondant icing. You can do this for however long you feel, ideally twice a week, but you can do it more if you wish. There is evidence base behind perineal massage in reducing significant, so we're talking 3rd and 4th degree tears. Do not do perineal massage if you are experiencing vaginal herpes or any vaginal infection, including thrush. Perineal massage should not hurt. If it hurts, stop and discuss further with your midwife. Perineal massage can be done either by yourself or your partner. You can be in any position you choose. Some women choose to be on the bed. Some women choose to do it in the shower with their leg up against the bath, or maybe a stool in the shower. If you do this stood up, just bear in mind you've obviously got your bump in front of you, so you may find you get a bit of pressure, and that's normal. You do with what you feel comfortable with. There is no ideal length of time for this. Only do it a couple of times a week from about 34 weeks. We say this because we know that the optimum time to be doing perineal massage is up to 6 weeks before delivery. If you have already had a vaginal birth and you feel that you have experienced any pain with scarring, perineal massage can also help reduce that scarring. Now, we still continue to do the 9-3 sweeping motion. However, if you're able to locate your scarring, you can also use vitamin E oil along that scar. And this will help soften that scar up ready for your next delivery. I advise that you have a feel of your perineum and inside your vagina for any scar tissue. Scar tissue will feel slightly rigid, or it may hurt a little bit when you press it. Another indicator that you may have perineal trauma or scarring from your previous delivery is painful intercourse. If you're worried about any perineal trauma and scarring from your previous delivery, please come and see me. Your midwife can refer you. If you are birthing out of water, your midwife may use a warm pack or a warm swab across your perineum as your baby starts to crown. This allows the muscles here to stay warm and soft, which will allow a little bit more stretch during delivery. The NHS has an app on iPhone and Android. It is called Squeezy. It will help to remind you to do your pelvic floors, which is very important after childbirth. During the postnatal period, you will still be bleeding. I advise that you change your pads with clean, washed hands. It is important to change your pad regularly. Before and after delivery, it is a good idea to be familiar with your vagina. This will allow you to identify any poor healing or a healing that you are not happy with and you would like to be seen by a midwife or a GP.
If you feel there is any burning or offensive smell from your trauma or even your lochia, please contact your midwife immediately or contact the helpline. Some women can get infections in an episiotomy scar or any trauma they have on their perineum. If you suspect this is the case, please contact your midwife or the helpline number. If you feel that you feel unwell or you have a fever, please contact the helpline immediately. If you experience a sore throat alongside the other symptoms I've mentioned, this could be a medical emergency. Please contact the helpline number.
If you have any pain recommencing sex, if you are experiencing any form of incontinence, please mention it to your GP.
I currently run a clinic on a Wednesday at Hazel Avenue Children's Centre. If you find that after your delivery and some months down the line you still do not feel comfortable in either your episiotomy scar or your first or second degree tear, please contact me. I'm also happy to see postnatal women. If you feel that your perineum has not healed as you expected, or you feel that there is still a lot of pain in that area, you are more than welcome to come and see me. Your midwife or the listening service will be able to give you the contact details for myself. You can find all the information I've discussed in your leaflet, which is on your maternity app, and midwives will be able to advise you further if needed.